You're listening to the Get to Know TRICARE podcast, your resource for information to help you get the most out of your TRICARE benefit. Hello, everyone. Thank you for tuning in to a new season of Get to Know TRICARE. I'm Calvin Keller from the Benefit Education and Research Team of the Communications Division at the Defense Health Agency. And over the next several weeks, we're going to be your resource for everything TRICARE for Life, also referred to as TFL. Our TRICARE for Life 101 series will help you learn the basics about TFL, which is important to know if you or someone in your family is about to turn 65 soon. Today, we'll kick things off by highlighting exactly what TFL is and the steps you need to take to get coverage. Here to help me do that is Lennya Bonivento. Ms. Bonivento is a health systems analyst with the Benefit Education and Research Team, also with the Communications Division at the Defense Health Agency, and she's one of our TFL experts. Lennya, it's great to see you. Thanks for being here.
Hi, Calvin. Thanks for having me.
So, Lennya, before we help our listeners start their TFL checklist, it's important for them to know exactly what TFL is. So what should those turning 65 need to know about TFL?
Well, there's a lot to know about TFL, but luckily it's not complicated. It's pretty easy. So first things first, TRICARE for Life is Medicare wraparound coverage. So that just basically means that it wraps around Medicare. So for anything that's covered by both Medicare and TRICARE, Medicare will pay its portion, and then TRICARE will come in afterwards and pick up any of the remaining costs. In order to have TRICARE for Life, you must have both Medicare Part A, which is hospital insurance, and Medicare Part B, which is the medical insurance. It's also important to note that it's an individual entitlement, and that just basically means that it affects you and not the entire family. Coverage is automatic once you turn 65 and have both Medicare Part A and Medicare Part B. So that's great because there are no enrollment forms to fill out. TRICARE for Life is also available worldwide. So that's actually really great because if you travel anywhere within the United States or if you go overseas, you're good because you have TRICARE coverage. One important thing to note is that Medicare does not cover care overseas, so TRICARE would be the primary payer. We have two contractors for TRICARE for Life. Wisconsin Physician Services provides customer service and claims processing for beneficiaries who live in the U.S. and U.S. territories. And then the second contractor is International SOS, and they provide the same services for beneficiaries who live overseas. One other thing I did want to mention is that there are individuals under age 65 that may become entitled to Medicare based on certain circumstances, for example, a disability, ALS, or end-stage renal disease. But like you mentioned earlier, we're only going to focus on those beneficiaries who will be turning 65 today.
Okay, that's great. Thank you for that introduction, Lennya. So just let me clarify one good point is that when you say TRICARE for Life is wraparound coverage, so I guess that means that Medicare is my primary coverage then. Is that correct?
That's correct. Medicare is the primary payer, and TRICARE would be secondary for all TRICARE covered services.
Great. Thank you for clarifying that. So listen, we just learned that TFL coverage is going to be automatic once you have Medicare Part A and B. Now, what steps, if any, does the beneficiary need to take to ensure they have coverage when they reach age 65? What's the first thing you recommend they do?
Well, the first thing I recommend is making sure that you show as eligible for TRICARE in DEERS. DEERS is the Defense Enrollment Eligibility Reporting System. It's a database where information on TRICARE eligibility is maintained. So that's number one, making sure that you show up as eligible in DEERS. Then after that, it's signing up for Medicare. So when you're going to turn 65, you have an initial enrollment period, which is 7 months long, and it's actually based on your date of birth. When you sign up for Medicare determines your Medicare effective date. So it's really important to sign up before your 65th birthday. This way you won't have a break in coverage. And we'll go over some examples to see what I'm talking about. So if your birthday is on the first day of the month, for example, October 1st, you should sign up for Medicare 2 to 4 months before you turn 65. If you do this, then you will be Medicare eligible on the first day of the month before you turn 65. So again, if your birthday is October 1st, you would be eligible for Medicare on September 1st, as long as you sign up anytime from June to August. If your birthday is after the first day of the month, for example, October 15th, then you should sign up for Medicare 1 to 3 months before you turn 65. If you do this, you will be Medicare eligible on the first day of the month you turn 65. So again, if your birthday is October 15th, you would be eligible for Medicare on October 1st, as long as you sign up for Medicare anytime from July through September. I know that's a lot of information, so the good news is that this information is all online. So please go to tricare.mil/Medicare to learn more about these scenarios.
Now, Lennya, will I be required to pay any premiums for Medicare coverage?
Great question, Calvin. Yes, Medicare Part A is free as long as you've worked enough quarters, but everybody has to pay a premium for Medicare Part B, and the premium is based on your income, and you can learn more about that by visiting ssa.gov.
Okay, so I know I might have to pay a premium, but now, Lennya, what if I'm still working and my employer is providing me health insurance? Do I still need to purchase Medicare to keep my TRICARE benefit?
Well, yes, to answer your question, you do need to purchase Medicare Part B in order to keep your TRICARE coverage. There is a rule that Medicare allows individuals to postpone their Medicare Part B enrollment as long as they are covered by employer-sponsored insurance. So you do have that option. However, if you do not have Medicare Part A and Medicare Part B, you will not have TRICARE for Life coverage.
Okay, great. Thanks for clarifying that, Lennya. All right, so let's see. So I'm interested in TFL coverage. So let's look at my checklist. I'm registered in DEERS, check. I'm turning 65 in a few months, check. I am eligible for Medicare, check. Now, how do I sign up for Medicare?
It's easy to sign up. You have 3 options. The easiest and fastest way is basically to apply with Social Security Administration online. Just go to ssa.gov. You can also call the Social Security Administration at 1-800-772-1213. And last but not least, you can always visit your local Social Security office. Once you sign up, you'll get a notice of award or notice of disapproved claim, and then you'll get your Medicare ID card in the mail. Your Medicare card will show your Medicare Part A and Part B effective dates, and then your TRICARE for Life will begin on the same date that you have Medicare Part A and Part B. I do want to point out that every TRICARE beneficiary must sign up for Medicare based on their 65th birthday, regardless of whether or not they may be eligible for Medicare.
Okay. So now that we know about the Medicare initial enrollment period, what if someone misses that enrollment period? Will there be other opportunities for them to sign up?
Yes, if you miss the initial enrollment period, you can sign up during Medicare's general enrollment period, which is January 1 through March 31st of every year. If you sign up during this time, then your Medicare coverage would begin July 1 of the year that you enroll. So for example, let's say you don't enroll in Medicare this year and you miss your initial enrollment period, then you can sign up in January of 2022 during the Medicare general enrollment period. So this means your Medicare coverage will start July 1 of 2022. So it's a really long time to go without TRICARE coverage. So again, another great reason to make sure you enroll in Medicare a few months before your 65th birthday. There's also another reason that you should enroll before your 65th birthday is that you may have to pay a higher Part B premium if you enroll during the general enrollment period. So again, another reason to enroll before your 65th birthday. There are some circumstances in which you may be able to enroll during a special enrollment period. And this, if you do this, then you wouldn't have to pay a penalty. But again, this is up to SSA. And if you want information on the special enrollment period, please visit ssa.gov.
Okay, that's good to know. So you can go to Medicare.gov to learn more about Medicare eligibility and enrollment circumstances. So next up on my TFL checklist is showing proof of eligibility and coverage. I know we talked about Medicare sending a Medicare ID card in the mail. Is there also a TRICARE for Life ID card that TRICARE issues?
No, there is no TRICARE for Life card. We get this question all the time, but the answer, like I said, is no. What you do have is your Uniform Services ID card and your Medicare card. So anytime you need to get healthcare services, you must always present your Medicare card and your military ID card. Once you get your Medicare card in the mail, you should go to your local ID card office so you can get an updated military ID card. You'll have to present your Medicare card to show proof that you have Medicare. And if you actually don't have a military ID card or your card has already expired, it's another reason why you should visit your local ID card office. Go to tricare.mil/deers for information on finding an ID card office near you.
All right, that's great. So now let's run down the TFL checklist for a second. So I'm eligible for TRICARE, check. I signed up for Medicare Part A and B, check. Medicare ID card is coming in the mail, check. I've received an updated military ID card, and my DEERS record is up to date, check. Sounds like I'm all set.
Yep, you're all set for TRICARE for Life.
Marvelous. Now, let's say I have a family. What happens to their coverage when I become Medicare eligible and I have TFL?
So nothing changes for your family. As I mentioned before, TFL is an individual entitlement. So basically the change is only for the person turning 65. If you have a spouse or children, they would remain in the plan that they currently have. They do have the opportunity to change plans and take advantage of the qualifying life event, which is the person turning 65. The birthday is considered a qualifying life event. So the family members have the ability to change plans if they want to. But other than that, nothing changes for them. If you happen to have a spouse that is younger than age 65, then they would also remain in the plan that they currently have, and nothing would change until they turn age 65.
And so I guess that once I become TRICARE for Life and I'm paying my Medicare Part B premium, if I have a spouse or if I have a family member that remain enrolled in Prime or Select, that will also, it may have an effect on how much I will have to pay for the enrollment fees for those plans for them. Is that correct?
That's correct. So if you and your family were enrolled, for example, let's say in TRICARE Prime, and you're paying a family enrollment fee, but now you will be under TRICARE for Life, your enrollment fee would change. If it was just you and your spouse, your spouse would now be paying an individual enrollment fee for TRICARE Prime. If it was you, your spouse, and children, and now you're no longer TRICARE Prime, but now it's your spouse with children, then the family enrollment fee would remain the same since it's still family coverage. Hope that answers your question.
That most certainly does. Well, Lennya, listen, I want to thank you very much for being here today and joining us to talk about TRICARE for Life, giving us an intro. And like you said, there's a lot to know, but it's easy to know. So I appreciate you taking the time and being here with us.
Thanks so much, Calvin.
Well, that's it for today's episode of Get to Know TRICARE. For more on TRICARE for Life, visit tricare.mil/TFL. In our next episode, Lenya's going to be back with us to talk about the different parts of Medicare. So be sure to tune in. For future content, be sure to subscribe to our channel on Apple Podcasts or Spotify. If you have questions about TFL that you'd like answered in future episodes, be sure to use the hashtag AskTRICARE. We look forward to hearing from you. For the Get to Know TRICARE podcast, I'm Calvin Keller. Thanks for listening. We'll be back with another edition of the Get to Know TRICARE podcast soon. For the latest TRICARE news, be sure to visit our website at tricare.mil. And don't forget to contact your TRICARE contractor or local military hospital or clinic if you have questions or need assistance.